Post-operative instructions following wisdom teeth removal. Immediately following surgery, maintain pressure on the surgical area by biting down on the provided gauze until the bleeding stops. A certain amount of bleeding is to be expected following a surgical procedure. Placing the gauze pad over the area and biting firmly will help prevent excessive bleeding. Replace the gauze as necessary until the bleeding stops. For a few days following surgery, you may become dizzy when getting up. Sit up slowly and give yourself a minute to adjust before getting up and walking. Avoid vigorous activities for 3 to 4 days after surgery. You may go back to your normal routine as tolerated. Please fill any prescriptions you have been given and take as directed. If you have been prescribed pain medication other than aspirin, Tylenol, or ibuprofen, Advil or Motrin, do not drive, operate heavy equipment, work around machinery or tools, or engage in any other activity that may be unsafe when groggy, as your reflexes and judgment will be affected by the medication. Antibiotics may be prescribed to help prevent infection. If you have been placed on antibiotics, take the medicine as directed. Swelling and stiffness are to be expected after surgery. Swelling around the face, eyes, and surgical site is not uncommon and may become more noticeable 2 to 3 days following surgery. Applying a cold compress to the face near the extraction site will help to minimize swelling. If using an ice pack, please do not apply ice directly to your skin, but place a cloth between the ice and your skin at all times. You may apply the cold compress for up to 20 minutes on and at least 20 minutes off as needed. After 36 hours, the cold compress will have no further impact on swelling. For 24 to 48 hours following your surgery, do not suck on a straw, rinse, spit, or smoke. Avoid hot and spicy foods and carbonated and alcoholic beverages. During the first few days after surgery, restrict your diet to liquids and soft foods, such as soups, yogurt, juice, and smoothies. Do not vigorously rinse or spit on the day of surgery. Resume brushing on the day of surgery, avoiding surgical sites with the toothbrush. After brushing, gently rinse with warm salt water. Half teaspoon of salt mixed with 8 ounces of warm water. Start the salt water rinse the day after surgery and repeat 3 times a day for 7 to 10 days. This will help to keep the surgical areas clean and will also help dissolve the sutures. Please do not use any irrigating syringe for the first 5 days. After your follow-up visit, if we have provided a syringe, fill the syringe with warm salt water and flush out the socket. This will flush out any food or debris. If you are experiencing numbness of the lip, chin, or tongue, be aware that this is usually temporary in nature and normal feelings should return after a few days. Until then, please be cautious while eating and chewing to avoid accidentally biting your tongue, cheek, or lip. A dry socket can develop when the blood clot gets dislodged prematurely from the walls of the tooth socket. Symptoms of a dry socket include throbbing pain at the surgical site, the ear, chin, adjacent teeth, and/or the jaw. These symptoms may indicate a dry socket when they occur 3 to 4 days following surgery and do not respond to pain medication. Please call our office if you experience severe pain, excessive bleeding, or swelling, or if you have any questions or concerns. If you are experiencing a serious or life-threatening emergency, please call 911 or visit the nearest emergency room.